this is Dr. Jawad from Total Health and Wellness Center. Today what I'm going to talk about how many Americans may have a magnesium deficiency. Now most Americans don't even know that they have magnesium deficiency, so that's why I'm just going to give out 8 common symptoms that you may have if you have a magnesium deficiency. And according to research, over 80% of Americans do have a magnesium deficiency. So if all you have to do is just increase the magnesium in your diet, either through foods or supplementation, or at least 80% of you, then you're going to transfer your life forever. Okay, the first sign that you may have magnesium deficiency is the headache. Headaches come in 2 common forms, the tension headache or your migraine headache. It doesn't matter which form it is. However, when you get tension headaches and or migraine headaches, that is a sign that you may have a magnesium deficiency. Why? Because magnesium is essential in relaxing overall muscles and also to cellular brain function. So if you have a magnesium deficiency, you may be getting a headache, either tension or migraine. Okay, the second sign that you may have a magnesium deficiency is if you're experiencing any type of muscle cramps. Now most people think muscle cramps is due to potassium. Yes, it can be, okay, but it's also magnesium. So if you're like an athlete or just lying in bed, and if you ever get cramps, most likely it's due to your magnesium deficiency. So definitely you want to increase your magnesium in your daily diet so you can avoid these symptoms. Okay, the third warning sign that you may have a magnesium deficiency is if you have osteoporosis, osteopenia, or weak bones or weak muscles, or you're getting injured in any type of way. Because magnesium is a major building block of your muscles and your bones. Yes, you need calcium, that is a must. However, magnesium is needed to help shunt calcium into the system and use it most effectively. So that could be a warning sign that you are magnesium deficient. Okay, the fourth warning sign that you're magnesium deficient is if you have diabetes or you have imbalance in blood sugar. If you eat something and then afterwards you're just really tired, I always call it the 2 o'clock blues. These are warning signs that you're not getting enough magnesium in your diet. Now magnesium is a critical mineral for the absorption of glucose in the body and as well as balance out your blood sugar. So if you're having these types of symptoms, like you're falling asleep after you eat, and especially if you're diabetic or you have an imbalance of blood sugar, then you need to increase your magnesium in your diet. Okay, the fifth warning sign that you may have a magnesium deficiency is if you have high blood pressure. Magnesium is shown to be the best alternative to naturally lower your blood pressure. So if you have high blood pressure, you may want to add on magnesium to your daily diet, either with foods or supplementation. Now the sixth warning sign that you may have magnesium deficiency is if you have insomnia or you have trouble sleeping. You may need to take additional magnesium for that. And I always recommend taking additional magnesium at your last meal, if it's a couple hours before bedtime, or 30 minutes before bedtime. Now the seventh warning sign that you may have magnesium deficiency is if you have anxiety or depression. Magnesium is phenomenal for a mood elevator, okay? I recommend a lot of my patients who are depressed or have anxiety to increase their magnesium intake, and I have a lot of success with my patients who have those type of symptoms by adding magnesium into their diet. Okay, now the eighth warning sign that you may have a magnesium deficiency is muscle pain. This is a true sign of magnesium deficiency in your diet. Things like fibromyalgia, or overall muscle pain due to tension at work, or if you have a long day at the office. Now, again, magnesium is essential for muscle relaxation. So if you have these type of symptoms, this is a true indicator that you are low in magnesium. So I always recommend to patients is that to increase your magnesium intake through rich foods or through supplementation. Now, people always ask me, what type of supplementation do I recommend? There's many out there, and first and foremost, I always recommend do your research on which type of magnesium is good for you. Personally for me, and what I recommend to my patients with success, is a magnesium chelate. Now Country Life is a great brand, but there are many brands out there. But before I recommend a supplement, I always recommend to increase the magnesium rich foods in your diet and use a supplement just as a supplement. And the last one, that's a bonus one, that you may have magnesium deficiency is if you're constipated or you're not having regular bowel movements. Now, there's different types of magnesium, and this is where magnesium citrate will come into play if you have constipation or regular bowel movements, because what this does, again, magnesium is a smooth muscle relaxant. It relaxes the smooth muscles naturally. So if you're experiencing constipation, that may be an indicator that you do have a magnesium deficiency. Now, first and foremost, I always recommend with constipation to take the magnesium supplement before bedtime. So after a 6 to 8 hour rest, then when you wake up, you're ready to go. And that is a magnesium citrate that I always recommend to my patient for irregular bowel movements or if you're constipated. So a lot of my patients will benefit, and I hope you as well. And if you like what you watched, please make sure to like us on Facebook and visit my website at www.totalhealthdupage.com. And as always, thanks for watching and be well. I'll see you next time. Thank you.